So this is Maureen Browne. She came last year. I think it's more than a year now.
Exactly.
First to get the diagnostics on CCSVI, and then to do the liberation treatment.
Which we don't want to call it. Exactly. Which we don't want to call it because there's such animosity because it liberated. What is liberated from what? I just want to have blood that's flowing normally and properly.
Yes, as it should.
As it should, exactly. We don't want any miracles. No, actually we would, but we'll settle for regular flowing blood.
Yes. So please tell something about your MS, your symptoms when you got it and all these
Okay, I arrived in Austria. I'm Canadian, and I arrived in Austria in '92, and at the opera house, I'm an opera singer, was, whatever, in between, and was diagnosed with MS in '94, so I had sort of a year before things started with me, with a leg that was tickling and funny, like ants were crawling around on it, and my English. And so then I had my first exacerbation, my second exacerbation, and upon the second exacerbation in '94, it was diagnosed with relapsing remitting MS. Mm-hmm. And since that time, I've had about 6 exacerbations, which a few were mild and a few were not so mild. One was my right side of my body when it was lame, and I was in a wheelchair for a while. But that only lasted a couple of weeks, and everything fortunately came back. A year ago, I lost my right eye to I don't say that properly, and it hasn't returned. But other than that, I'm feeling quite fine and lead a fairly, now, after, post-op, quite a normal life again.
So you have begun again to sing, not at the opera house, but like chansons? And
oh, exactly. I'm working. Yes, I'm working at finding a little niche where I can go back to what I love to do, and hopefully help people bring the fact that some people that aren't perfectly healthy also have something to say in the musical world. Yes.
Like with this procedure, I think people also would be interested to hear what was it like, because most of the people say like the operation. So
yes,
it sounds like something very big knife, something very hard. And then what was the feeling? How much has changed with this procedure for you? Did it come immediately, or was it time to get the improvement, or is the improvement still going on?
No one knows these questions, and I feel, and in fact we have to see ourselves as, we don't want to say guinea pigs, which is the expression in English, but it's somewhere we're discovering together. Let's say that's much more palatable. Since the operation, which is just over a year ago, I have had enormous improvements in the quality of life that I lead. I'll start with the operation. The operation was, I heard that it didn't cause pain. I mean, it really wasn't, I had never been operated on before, so I had nothing to compare it with, but it was quite easy to take. I mean, obviously they have to go in you, and so you feel them going through the veins. That means there's sensation. I wouldn't describe it as painful. I would just sort of, you feel like there's something that shouldn't be there. But I wouldn't associate that with pain. And after, I thought the care was, and obviously I'm here, but the care was very good, and the doctor was wonderful, and he opened my vein that was closed, and it closed immediately. So then he came over to me and he said, "What are we going to do?" Which he had warned me about. And I said, knowing that it's disputable, this whole chapter, I said, you know what? I don't want to go backwards. I want to go forwards. I've been where I've been. I want to go somewhere else, which is a risky decision. I realize. I mean, I choose to deal with it with a bit of humor, but I really didn't want to go back to where I was because I wasn't functioning I was functioning minimally. And so I chose, let's go for stents, although I was informed that the stents at that time were not designed for veins, they were designed for arteries, and so they're different construction because of course in the different makeups of veins and arteries. So I decided let's go for the stents, which I got 2 overlapping ones. And that, I realized there's risk in that, and I realized all of that. A year after, I've been told 3 times, yesterday again, that they haven't moved. And
yes, and they are still free, so there's no blood clotting, everything's okay.
Everything's okay, and they're exactly where they put them. Because of course they can wander. I mean, we know what the side effects are. They can wander, and of course I took that Risicone, and they've stayed exactly where I put them. And now they told me again that there's no chance, or the chances are extremely slim that they will move now that it's been a year.
Mm.
And I really don't feel them. At first there's a sensation that again that something's there that shouldn't be, but it's not a pain sensation. It's just sort of like, hello, something's here that shouldn't be, and we can't seem to get rid of it. But anyway, I had some problems with headaches after the surgery, and they are now gone, fortunately. And I didn't understand. I think it had to do with actually my eye that's not working properly.
So this has not changed?
No, yeah. The eye has not changed, and they warned me before the surgery that this
damage
that's been done is done, and unfortunately there's nothing that can be done. So I realized that, although I hear that people with some eye problems in double vision have some improvement and stuff, but my problem was not corrected or in any way influenced, but could not be. And that's obviously logical to me in my non-medically trained brain, that the damage that's been done is there to stay. And I have no problem with that, and that was actually one of the instigating factors in my decision to do this, is that if I've lost one eye to the sickness, and I didn't want to lose another one. And so I thought, I've got to, knowing that there's the blood, what do you call it, there was a lot of blood sitting up here above my blockage, and when I saw pictures of that, I was like I was mesmerized, about I can't live with this any longer. I've got to get the surgery done right away, because it's right in your brain and you don't want blood sitting around. We know it's corrosive, it can do damage, and for me it was clear that it had to be done, because I saw this huge coagulation. Is that a huge amount of blood sitting where it shouldn't, because it couldn't move properly. And this is where I go into my argument, is I don't, there's a movement against this theory, and I respect them until there's 5 years of research that's been done and protocol as things need to be done in science. I understand their hesitation, but with us, the patients, I lost one eye, and I thought in 5 years I could lose the other one. I don't have the time to wait. And if so I called, and I'll go back to, I contacted Dr. Stehling in Austria, because I saw a Canadian, on internet, I saw a Canadian television show, W5, where they interviewed him for a half an hour regarding this whole new theory. And it was so interesting, and I thought, he's from Austria, and I'm from Austria, and so I Googled him that day, and he wrote back within a few hours and said, I'm going to be in Graz that week, and he said, he looked at my MR pictures, he said, get a couple of your latest MR pictures, and he looked at them, and he said they weren't proper pictures, because they need to look at the veins for this new theory, and normal neurological medicine is not interested in the veins, it's not on their priority list, therefore the pictures were not substantial for him, but he said it looks like that your case could be a case for this SCCSVI theory. And then I said to him, what should I do, where should I go? And he suggested that I come here to Frankfurt. He said, they are the ones I can recommend at this time. There's a lot of places offering these services, and he wasn't exactly happy with some of their protocol, and I had blind trust in this man that's been working on this for 30 years, came here and have had quite amazing results. I don't want to get over dramatic, but I have to, in that I've been given a major part of my joy of life back. And that's, it's actually impossible to describe. I realized that my brain was not functioning. It was sort of functioning minimally. But now, I don't think it's maximum. I don't know if it ever functioned maximally. But I'm much more the person that I used to be like 15 years ago. And I'm so eternally grateful. And regardless of the MS, is the argument I want to go to actually. If a person, and they're saying that people that have this MS diagnosis, 6 or 50% or 60% maybe have some problems with their veins. That's, for me, enough to say, I'm going to look and see if my veins have some blockage. And by me, for them opening this, there is still some stenosis that they're weary of working with me. There's still other problems, but this major blockage has changed my life day and night. My daughter, who's 12 years old and has seen me in a wheelchair, what a youth to see what life's really about. So she gets it. She says, since the operation, Mama doesn't sleep anymore, because I was always sleeping, and then she got to watch TV.
Yes, this kind of
cheap babysitting, yeah. You know, Mama that's on a single mom that doesn't have any help is put on the TV and I need to sleep.
Yes, this fatigue.
Yeah, because I always have to sleep in the afternoons.
Yes,
always.
Most of the MS patients have.
And I always went to bed at 8 o'clock or earlier with my daughter. Actually, I was so glad. Go to bed and then I can go too. And now that changed actually immediately after the operation. I felt immediate energy, and I felt. Some people say they feel, I'll just speak for myself. I felt I had a numbing in my hands for about a month before I had this procedure done, and my hand would fall asleep, my arm would fall asleep about 5 or 6 times a day. For no reason. Usually when they fall asleep, you've had some sort of block in circulation. Yes. But this was for no reason, at least visual, that I could imagine. And that went away immediately the day I had the operation done. And also my fatigue was also better. In fact, I stayed up the night after the operation. I didn't have this necessity to go to sleep. And that was that. And then after a year, my life quality has improved so much. I'm thinking about going into the workforce again. I don't know who wants sort of we'll see. I'm gonna put my talents out there, and maybe there'll be a workplace for me, because I have not only the desire. I had the desire before the operation too, but I didn't have the strength to do it. And now I'm having the strength. Maybe there's a possibility that I can leave my retirement, my early retirement, because of not able to practice my career choice anymore. Yes, exactly, profession.
So the next video we see with Maureen will be seeing Maureen on stage.
Well, I'm not giving up on my dreams yet. We'll see, and maybe I want to help people get their brains around, the CCSVI. Just get blood flowing in MSers as it should be, and give us perhaps a chance at a lot of people say after the procedure that they've had less fatigue, and this fatigue is so debilitating that's such a present from God. To have this back, to have a possibility of 4 hours without having to go to sleep is so wonderful, and I just want to have that people maybe get a bit of their life quality back. No one's speaking about, at least in my books, that the serious people are not talking about a cure or anything. I know there's been headlines in Canadian newspapers and magazines, the new cure, and that's headlines.
No, it's just about symptoms.
It's just about, and what we're interested in is getting a bit of our life